there was a chilling effect on the hospital M&A front last year as a result of policy in DC. I think while a lot of operators really thought through how are we going to digest these changes and just focus on operations and preparing for what's going to be a tidal wave of changes coming this year, but especially hitting in 27 and 28. Those are really impacting how health systems thought in 25, but now we're seeing more activity as they kind of hone in on their strategies and think through what are the strategic partnerships with other health systems, with other provider types and outpatient services that we might want to focus on to kind of prepare ourselves and brace for the impact of some of the changes coming in the next couple of years.
You know, I think getting as plugged in as it can in states that are of interest. So if a system is looking to expand, becoming a regional system, or do even one of the larger mergers where it's cross-country kind of situation, making sure you know that market before you actually begin to get deep in those discussions. We're still seeing some systems that are doing this, and they wait until they have worked out an LOI or done something along those lines, and then they realize, oh, this is a complicated jurisdiction that we've just stepped into. And as I mentioned before, right now, one of the most significant regulatory hurdles is actually things that are happening at state level. And so do the intel, do the digging and research early on to understand the dynamics of the states that you're interested in expanding to.
Buyers need to take stock of the states they're looking to continue to operate in, and whether or not those states are going to be likely to be favorable deal environments, or whether they need to take extra steps to comply with more harsh regulatory regimes. The second thing that buyers need to do is when they're onboarding different targets, they need to really do heavy compliance due diligence and see if anything needs to be changed or retroactively reported or self-reported to basically onboard as compliant as possible.
I think they have to be mindful of what those are, make sure they're asking the right questions as part of transactions, like get ahead of it. So don't start doing your billing coding audits, your compliance reviews like the day before closing. Do those at the very beginning because it can impact the actual, Q of E. So oftentimes we can't get started until Q of E happens. I'd much rather do a billing coding audit, a proper sampling, figure out if that provider supplier's actually billing appropriately, and do we have either historical risk or the possibility that we have to shut down various service lines because that person or that entity is not actually billing and coding correctly, and what does that look like for our go forward strategy? Do we have to shut down a service line that potential target is saying is hugely profitable because they're not doing it in a compliant fashion? And so I'd rather know that up front before it's 2 days before closing and there's not much we can do about it. So I think there's definitely a push towards getting better compliance readouts earlier on, because one, they could definitely impact the financial assessment, let alone just overall compliance risk profile of operations once you acquire them.
Yeah, I mean, this obviously seems a little bit self-serving, but really to try to bring in antitrust counsel as early in the process as possible so you can identify whether to expect antitrust scrutiny of your transaction. You can plan for it, prepare for it, do the analysis you need to, so you can allocate risk in your definitive agreement appropriately, whether you're on the buy side or the sell side, to account for any antitrust scrutiny, any remedies that may be required, and just build in enough time in the agreement so you can get through that review process. So starting that review as early in the deal life cycle as possible, and planning is the most important thing, I'd say.